Everyone's in a normal while.
Hi, Dr. Soul. How are you?
Good. How are you, Michael?
Uh, I'm just loving being in the hospital.
You still is the whole group still having to do in-house call?
Oh, no, we got a computer that works, so we're able to not do that.
Well, that's good. That's good. Did you have a busy service?
Today it got a little busy.
Yeah.
We got some interesting patients, for sure.
Good deal. Good deal. Good morning.
Good morning. Can you see my screen? Yes.
Yeah, looks good.
Can you hear me?
Yeah, I can hear you.
Good morning. It's my pleasure to introduce our speaker this morning. Dr. Jaime Shoup is a PGY5 in the Child Neurology Residency Program, and he will be staying with us, I should say, in July, starting a pediatric epilepsy fellowship here at University of Louisville School of Medicine, and will be our first fellow in pediatric epilepsy. And we're proud to have him present this morning on autism spectrum disorder, piecing together the puzzle. Thank you.
Yep, thank you for that introduction. Okay, so we can get started with some kind of objectives and outcomes. The main objective is to review the genetic, immunologic, and environmental factors that are associated with autism spectrum disorder. And then with that objective comes the outcome to understand the different associations underlying autism spectrum disorder and how this contributes to a precision medicine approach to their care. Just a little bit of a roadmap for us. So start with kind of a definition of autism spectrum disorder, go into some of the epidemiology before delving into more of the genomics, epigenomics, proteomics, metabolomics, and exposome contributions to autism spectrum disorder. And the five of those, genomics, epigenomics, proteomics, metabolomics, and exposomics, all constitute something called a multi-omics approach. We'll kind of wrap things up looking at some neurodiagnostics associated with autism spectrum, and then some current challenges and future directions before wrapping up with a summary. Starting with the definition, autism spectrum disorder, according to the DSM-5, is characterized by deficits in social communication and interaction across multiple different contexts. It has to be present in early developmental life, as well as presence of restricted, repetitive behaviors, as well as interests or activities. Looking at some of the epidemiology, currently it's estimated that 1 in 54 children are estimated autism spectrum disorder. This seems to be increasing over the past decade. Initially was attributed more towards improved screening and hasn't seems to slow down though since then. You can see there's a steady trend in the graph provided on the right. This stopped at 2007 but continues to rise despite further efforts looking into underlying causes. There is a notable male to female predominance, about 4-to-1. And of note, it is present in all racial, ethnic, and socioeconomic groups. And there doesn't seem to be a discernible difference that could account for any sort of differences in the population. Starting off with some of the genomics associated with autism spectrum. So there is a clear genetic basis simply by looking at sibling recurrence rate, which is estimated to be about 3 to 10%. As well as a monozygotic twin concordance, which is around 60 up to 90%, depending on the study that you look at. Current genomic testing, however, doesn't always identify a cause, with about 5 to 14% identified on a chromosomal microarray, which increases on whole exome sequencing to about 8 to 20%, and a little bit more with whole genome sequencing. But still, there's about 70 to 75% of cases we never find a cause on these genetics. Looking at the genetic mechanisms of autism spectrum disorder, we have both monogenetic causes, which are captured more so in those genetic tests that we look at, polygenetic, which may not necessarily attribute in those genetic because each of the genes has a small effect size and doesn't necessarily get reported out. Somatic mosaicism, unless you're looking at the specific tissue or the brain, may not be able to identify those cases and epigenetic modifications, again, not being captured by those conventional genetic evaluations. Looking at the monogenetic causes of autism, there are numerous monogenetic causes that have been identified, but taken together only count for about 5 to 15% of patients. There are some well-known monogenetic cases that include MECP2 or Rett syndrome, UBE3A or Angelman syndrome, CACNA1C or Timothy syndrome, FMR1, which is Fragile X, or TSC1 or 2, tuberous sclerosis. We'll go into detail about some of these listed. Autism risk teams, however, seem to break down into multiple different categories. There seems to be enrichment in the genes with functional implications associated with synaptic biology, gene expression regulation by transcription factors and chromatin regulators, and kinase phosphatase activity proteins. Delving into some of the synaptic functioning proteins, there's an array of them that constitute both the presynaptic as well as postsynaptic proteins, in addition to some of the scaffolding proteins that are listed here. The synaptic adhesion molecules, or neurolignins and norepinephrine, are one group or two groups that are associated highly with autism spectrum disorder. Phenylketonuria, such as PCDH19, has been associated as well as albumin, CDH8, is one example. Contactin and contactin-associated proteins, too, have also been associated with autism, as well as synaptic scaffolding proteins, PROSAP and STEM. Ion channels have a departure from some of these more scaffolding proteins or adherins, also implicated, such as SCN1A associated with Dravet, or KCNQ3, CLCN4, one of the chloride channels, or potassium channels. Neurotransmitter receptors have also been implicated, such as the dopamine receptor DRD1, serotonin receptor HCR1B, the GABA receptor GABRA3, or one of the NMDA receptors, CRR1. Finally, some of the synaptic formation and organization, one of the more well-known proteins associated with autism is SYNGAP1. According to the Safari Gene Database, there are a total of 1,128 genes that have been identified to be associated with autism. As you can see in the depiction here, there can be broken down into syndromic with high confidence. There's the less high confidence but still strong evidence for, which is around 232 genes. And then there's kind of medium evidence genes, which is around 699. And then the lower evidence genes, which is 103. You can see from the heat map below that there's a multitude of genes across all of the chromosomes, but does seem to center in certain areas, such as on 16p or on 1q. Delving into that a little bit more, the clusters of candidate genes do show us that there are certain vulnerable regions within the chromosome, such as on 1p, which you can see here, 3q, 7q, 15q, and 16p. There's also, which is not shown on this linkage study chart, the X chromosome that has several that we'll delve into. Moving away from some of the more monogenetic causes to polygenetic causes, this occurs because genes that are associated with autism spectrum disorder have phenotypes that are pleiotropic, meaning within a specific phenotype, there is variability in the phenotypic expression. This means that other genes, or modifier genes, as well as environmental factors, modulate the gene expression and lead to different phenotypic expression. There are different mechanisms by which this can occur, which include epistasis as well as structural variants that I will go into. Epistasis is the genetic phenomena when the effect of one gene mutation is dependent on the presence or absence of mutations in one or more other non-allelic genes or modifiers. According to the study Wise et al. In 2017, they demonstrated using a reverse pathway genetic approach that there is strong evidence that epistasis contributes to autism spectrum disorder, and the RAS-MAPK genes demonstrated a strong enrichment in the single nucleotide polymorphisms in ASD-affected individuals, with a P of less than 2.2 times 10 to the negative 16, so clearly associated. Going into more of the structural variants, so these are defined as large genomic changes, which generally greater than 50 base pairs, that include both insertions and deletions, or copy number variants, inversions, and unbalanced translocations. You can see on the left that there's multiple depictions of these different structural variants. Structural variants in autism spectrum disorder have been long suspected, and according to Kainer, in 2023, using a non-Mendelian pattern in pedigrees of parent-child genotypes from ASD families, they demonstrated structural variant enrichment specifically in autism spectrum disorder risk genes. They found that most of them are in non-coding genic spaces, overrepresented in expression quantitative trait loci, suggesting they affect gene regulation. And this is confirmed with overlap with differentially expressed genes in postmortem brain tissue of autism individuals. They also identified structural variants in the GRIK2 and the ACMSD, or kynurenine pathway, that associated with nonverbal cases of autism that were previously not identified as autism risk genes. So the power of the structural variant was realized through this specific study. Moving on to some of the more transcriptional regulation genes associated with autism. We have MECP2, FMR1, RBFOX1, and CHD2. Starting with MECP2, or the methyl CpG binding protein 2 on the X chromosome Q28, this is associated with Rett syndrome and is a high confidence syndromic genetic cause of autism, or that red category that we saw in the Safari database. The MECP2 functions several ways, of which transcriptional activation and repression is one of them, chromatin organization, which chromatin condensation and chromatin looping is a part of, as well as cell signaling, protein synthesis, ribosome biogenesis, as well as neuronal maturation. You can tell that this is very important for neurodevelopment. Further role of the MECP2 in autism shows that significantly increased MECP2 promoter methylation is present in autistic male frontal cortex when compared to control. In Najarad 2007, the percent promoter methylation of MECP2 significantly correlated with reduced protein expression. And it should be noted that this was found as a somatic change and was not found due to a overall MECP2 mutation that Next, we have the FMR1, or Fragile X mental retardation 1 gene. This is the XQ27.3. This is associated with Fragile X syndrome caused by a trinucleotide repeat, or CUG expansion, of greater than 200, as you can see on the left. This is the most common single gene cause of autism. In fact, 50% of males and 20% of females who have FMR1 mutations also present with autism. It is a high confidence syndromic classification as well, according to the Safari database. The FMR1 gene also functions by mRNA binding protein, responsible for the localization, stabilization, and translation of approximately 4% of fetal brain mRNA. Many of the mRNA transcripts of the FMR protein handles are for synaptic proteins. It also plays a critical role in modulating the behavior of several neuronal units, such as the calcium channels listed below. So as you can see, FMR1 is very important for synaptic functioning, as well as the transcriptional regulation that we alluded to with other genes. The RBFOX1 gene, or the RNA binding protein, FOX1 homolog, on 16q13.3, has also been identified through numerous studies to have variations associated with autism and developmental delay. This gene, however, has a strong candidate risk classification, or that 2 classification that was seen before. This works by regulating both splicing and transcriptional networks. Specifically, cytoplasmic RBFOX1 regulates the expression of synaptic and autism-related genes. You can see all of the genes that are associated with the RBFOX1 gene, including both synaptic transmission, calcium signaling pathways, as well as ASDM12 gene implications. There's a lot of overlap as well. Finally, talking about the CAC2 gene, or the chromodomain helicase DNA binding protein 2, on 15q26.1, there are numerous reports of de novo loss of function variants that have been reported in the Simmons Simplex Collection, the Autism Sequencing Consortium, the Autism Clinical and Genetic Resources in China cohort, the Autism Genetic Resource Exchange, and the Autism Simplex Collection. And all of this taken together has led to a high confidence syndromic gene classification according to Safari. The CAQ2 protein is a chromodomain or chromatin organization modifier, an SNF2 related helicase ATPase domain. It alters gene expression by modification of the protein chromatin structure, and this alters access of transcriptional apparatus to its chromosomal DNA template. This is very important to either be permissive to gene expression or to reduce gene expression. And this is also very important to neurodevelopment. The next category is the phosphatase kinase regulation protein. Many of the phosphatase kinase genes are associated with autism spectrum disorder. These genes create enzymes that control cell cycle growth and differentiation, including neural cells. They include genes like PTEN, CDK8, BRFK2, CAS, and CDKL5. We'll go over one of these, PTEN, as it is highly implicated in autism. It's a phosphatase-intensive homolog on 10q23.31. Deleterious variants of PTEN have been identified in individuals presenting with autism and macrocephaly across multiple studies, including the Autism Sequence Consortium and the SPARC cohort. It has been given a high confidence syndromic gene PTEN acts as a tumor suppressor gene through the action of its phosphatase protein product involved in the regulation of cell, which preventing cells from growing and dividing too rapidly. However, when defective, the PTEN protein interacts with the protein of a second gene known as TP53 to dampen energy production in neurons. And this is evident by abnormal levels of energy production in the cerebellum and the hippocampus, both of which structures have been implicated in learning as well as social interaction. It's not surprising that this is associated with autism spectrum. This is a graphical abstract of the MSS-NG whole genome cohort that was updated in 2022 to include a total of 11,312 probands. And what they found with their genetic variants is that the largest genomic contribution was actually PTEN, followed by 16p11.2, then Neurexin, and then MT. But all of that taken into account only amounted to 14% of the total population. So 86% were never found to have a specific monogenetic cause to their autism. So what's going on there? Here is a depiction of all of the genes that are involved in the synapse, which there's quite a bit. And any one of these, if you go through the Safari database, shows us that there's implications. We see SCN2A here that we talked about, the GABA receptor, we see KCNQ3. So there's many different functions along this synaptic cleft that are involved that need to be highly regulated and performed well in order to, properly socially develop, as well as prevent these repetitive behaviors that are seen. So we know that there's these genes that can be found with, blood samples, or they're in all of the cells. But what about somatic mode mutations? Mutations that only occur in one part of the body, such as the brain. So a collection of 5,947 trios with Lynn et al. In 2022 found that 7.5% of mutations were actually post-zygotic, meaning they only occurred after, conception, and only a fraction of the genes were affected henceforth. Specifically, they found in autistic patients that gene mutation enrichment occurred in the amygdala more often. And currently, they estimated that it accounts for about 3 to 5% of simplex ASD cases. So that captures, a fraction of the patients who we weren't able to capture before. Another concept is epigenomics. So these are heritable changes in gene expression without changing the DNA sequence. This includes histone modification as well as DNA methylation. Here is a list of all of the epigenetic changes that are associated with autism in the literature. You see specifically that there's hypermethylation of SPAM1A1A, as well as CHFR and AURKA genes. You see higher methylations in the placenta from autistic subjects by placental methylome analysis. Lower methylation of proline-rich transmembrane protein, or PRRT1 gene, is involved in synaptic functioning. We saw hypomethylation in these additional genes, MAP-A-KIP3 and NALP1L5, as well as increased expression of PET methylcytosine deoxygenase 1, 2, and 3. Finally, there's also some rodent live animals that show that valproic acid exposure leads to autistic-like phenotypes in male offspring. I'll go over a little bit later. And it's thought to be due to epigenetic changes. Decreased expression of DNA methyltransferase, or DNMT1, has also been found. as well as changes to the MTHFR polymorphisms, as well as acetylone signatures at greater than 5 times its regulatory elements in syndromic and idiopathic diseases. We have some evidence for epigenetic changes, but clearly not a substantial amount, and further work within this field will help to elucidate further. Going more towards downstream in the protein sphere, this can be used as a potential autism spectrum disorder biomarkers, and can also give us a clearer idea of what genes are being expressed and why, the autism phenotype arises. It has been found that there are increased levels of proteins responsible for synaptic creation, or brain-derived neurotrophic factors, BDNF, and glial fibrillary acidic protein, or GFAP. Furthermore, BDNF levels were associated with the severity of autism in one, and is thought to potentially be protective in the presence of large amounts of BDNF, being that it's a neurotropic factor. The STOP or MAC6, significantly reduced in patients with autism, is also an important proteomic marker that can be utilized not only for screening, but maybe to understand exactly what is going on for these patients. Hewitt's done in 2021 analyzed 1,100 proteins and identified 9 proteins that were altered in autistic ways when compared to normal developing control. Taken together, these 9 proteins had a sensitivity of 84%. It made up 5 core proteins, which was like the MAPK14, the immunoglobulin D, dermatopoietin, or DERM, efferin, type B receptor B, or EphB2, and soluble urokinase type plasminogen activator receptor, or 2. When added, the 4 additional proteins, or receptor tyrosine kinase like orphan receptor 1, or ROR1, platelet receptor GI24, eukaryotic translation initiation factor 4A, H, and aryl sulfatase B, taken all together, the sensitivity rate to about 84%. Quite impressive, and could potentially be used as a panel for screening in at-risk individuals. Going to kind of more of the metabolic substrates of these patients, we see that there's altered fatty acid profiles that have been demonstrated in autistic cohorts. In one study, all saturated fatty acids were elevated except for propionic acid, and a decrease in most of polyunsaturated fatty acids was also observed. This is theorized to be due to a combination of oxidative stress burden, mitochondrial dysfunction, and heavy metal exposure, one of which was lead that was theorized to be contributory. Children with autism have also been demonstrated to have lower levels of EPA, DHA, and arachidonic acid, all of which are important for the production of prostaglandins, which is part of our inflammatory response, as well as resolvin. There is a higher ratio of N6 to N3 polyunsaturated fatty acids, and is correlated significantly with symptoms associated with autism. Furthermore, COX2 or cyclooxygenase 2 is a main regulator of PDE2 synthesis and is implicated in the canonical Wnt signaling pathway. The Wnt signaling pathway has been also shown with abnormalities to be demonstrated in many ASD risk genes, including CHD8 and CJ. So it does seem that this inflammatory cascade is important to the presence phenotype of autism spectrum disorder. Looking into the literature about the COX-2 gene, Long in 2019 demonstrated that COX-2 knockout mice exhibited autistic-like behaviors such as hyperactivity, repetitive behaviors, altered motor strength, and awkward social interaction. Yu et al. In 2008 demonstrated a relationship between autism spectrum disorder and polymorphisms in the PTGS2 gene, which is the COX-2 gene, in a study of 151 Korean trees. It should be noted that none of these patients with the PTGS2 polymorphism had a mutation that would be classified as pathogenic on a test. They were just found to be associated with autism in this specific study. Further, several studies have demonstrated that there are altered levels of heat shock protein, caspases, interferon gamma, and transforming growth factor beta 2 in patients with autism. So it does seem that there is this inflammatory response that is going on in autistic individuals that may, underlie some of the pathophysiology of what's going on, potentially providing a substrate with which we can target. As far as further metabolomic analysis, there's mitochondrial dysfunction. About 5% of children with autism demonstrate mitochondrial dysfunction, which compared to 0.01% in the general population is statistically significant. A meta-analysis of controlled studies found those with autism as a group demonstrate abnormalities in lactic acid, pyruvic acid, carnitine levels, creatine kinase, and transaminases as compared to typically developing contemporaneous controls. In mouse models, mitochondrial DNA ND16 missense mutations, when inserted into the mouse germline, was found to induce autism spectrum disorder endophenotype. So the mitochondria does seem to be important in kind of maintaining energy substrate for the brain and the proper neurodevelopment, and may underlie a subset of autistic individual phenotypes. Here is a list of all of the mitochondrial studies that have been found. And as far back as 1993, there were markers of mitochondrial function that were found to be abnormal in the brains of autistic individuals and correlated with their behavior. In 99, elevated lactate in the frontal lobe was found in 1 out of 9 children with autism, and NAA was reduced in the cerebellum of autistic patients. In 2003, with Friedman, no significant difference was found in mean lactate in autistic and control groups. Interestingly, the patient population that is looked at does play a big role in a lot of these studies have small numbers of patients, as you can see, so it is difficult to fully garner the associations without larger N. Higher levels of oxidative damage to mitochondrial proteins in BA41 and 42, as well as BA22 in autistic groups, was found, as well as complex 4 higher activity in the autistic group. Lower ETC complex activities in cerebellum, frontal lobe, and temporal lobe were found in 8 patients in 2011 with the QAnon group. Decreased expression of mitochondrial genes in the anterior cingulate motor cortex and thalamus was found in 8 patients in 2012. So there's no significant difference in mean lactate in autism in control groups in 2012. One thing that we can see from this chart is that the mean lactate does not seem to be significantly different between groups, with the largest N studies demonstrating this. Finally, decreased ETC complex gene expression in the cerebellum, as was found in 9 patients in 2012, as well as significantly decreased connotates activity in the cerebellum, and BA2 in autistic group. Reduced expression of the ETC genes, complexes 1, 3, 4, and 5, was found in the anterior cingulate gyrus, thalamus, and motor cortex non-specific individuals, as well as brain phosphocreatine reduced in muscle and frontal cortex in children with mitochondrial dysfunction. Finally, reduced ETC complexes, as well as decreased ETC complex 1 and 5, as well as 1 and 4, were found in autistic individuals in the following study. So taken all together, there does seem to be at least a subset of patients that have mitochondrial dysfunction. And identifying those individuals may be important for a more targeted approach to their underlying physiology. Shifting more towards the environment, we'll take into account the exposome. So which environmental exposures seem to be implicated in autism spectrum? So the gut microbiome, toxins, congenital infections, and maternal autoimmunity have all been implicated in autism. Starting with the gut microbiome, in one study, Bacteroides fragilis was linked to gastrointestinal abnormalities in autism spectrum patients. The thought was that due to this bacterium having enzymatic capability of converting indoles from tryptophan, it raised the question of whether differences in the microbiota played a pathogenic role in autism spectrum disorder, which has long been theorized to have a serotonergic basis. Previous studies have demonstrated an increase in serum serotonin in children with ASD, thought to be secondary to gut hypersecretion. Increased tryptophan in the gut is associated with severity of ASD symptoms and less serotonin availability and production in the brain. ASD patients have also been shown to have less gut microbiome diversity, with a sparsity of Prevotella species when compared to neurotypical individuals. In one large meta-analysis with West et al. In 2022, they found that Clostridium bolte was found to be consistently more abundant in ASD children when compared to neurotypical individuals. Also, Bacteroides stercococcus has been found to be lower relative abundance in ASD patients when compared to neurotypical children. Fortunately, there's high gut microbiome heterogeneity that varies with age and gender. And so the authors of that meta-analysis found it difficult to pinpoint exactly single entities as contributory to the pathogenesis of autism spectrum disorder. But perhaps with larger data sets, we'll be able to further elucidate. Shifting to another environmental exposure are things like air pollution, heavy metals, or specifically lead, pesticides, phthalates, which are depicted here, microplastics, polychlorinated biphenyls, which is also here, and valproic acid, depicted here, have all been implicated in autism spectrum disorder pathogenesis. Nutritional factors such as iron and folic acid have also been looked at and have some association. I would be remiss in not mentioning vaccination, as this is something that comes up frequently as a potential cause. Numerous studies to date, however, have not found substantial evidence that vaccination is associated with an increased risk of developing autism. In a Danish study of 657,000 patients, of which 6,517 were ultimately diagnosed with autism, found no overall increased risk for the developmental disorder among those who received the MMR vaccine when compared to those who had not gotten it. This is pretty good evidence to suggest that vaccines do not, in fact, cause autism. Congenital infections have also been implicated in autism. Of note, congenital rubella and CMV have been particularly implicated. As many as 8 to 13% of children with congenital rubella syndrome developed autism during the 1960s rubella epidemic. It's quite impressive. And one study looked at the effect of rubella on the liver and how it changed the vitamin A level that could cause toxicity of vitamin A in the mother and potentially cause the issue with autism development later in the susceptible children. Children of mothers who are seropositive for CMV have statistically significant differences of social responsive scores, or SRST scores, which were 3.6 to 4.2 points higher than children. Of note, the same study looked at HSV2 seropositive women, which did not demonstrate a difference in the social responsive scores, providing some evidence that CMV in particular may be more implicated in the development of ASD. Finally, we'd like to discuss maternal autoantibodies. This is another area of interest that is leading to interference with prenatal neurodevelopment. The fetal brain is particularly vulnerable to maternal autoantibody exposure. The reason for this is because of the variable permissive nature of IgG in the fetal blood-brain barrier. The Childhood Autism Risk from Genes and Environment study demonstrated IgG reactivity to fetal brain protein found at 37 kilodaltons and 73 kilodaltons in 11.5% of mothers with autism spectrum disorder that were not found in the mothers with neurotypical children. Multiple studies have replicated similar findings with rates in the 10 to 12% range. One study looking at the different patterns of autoantibodies found that CRMP1 and CRMP2 had the greatest association with progression to autism in autism. And it increased the autism spectrum disorder diagnosis 16-fold. There are also other autoantibodies that are depicted here that have been implicated as well. They include GAD65, serotonin receptors, CFAP, ribosomal proteins, UM1 or gangliosidases, MP, which we saw earlier was implicated in autism, as well as some of these maternal autoantibodies in autism spectrum disorder, or YBS1, LDHA and B, and Casper2. Next, I'd like to talk about some of the neurodiagnostics. See, is there anything there that could help us to further understand autism spectrum disorder and its epidemic? Starting with neuroimaging, and then going to EEG, evoked potential, and eye tracking. So neuroimaging demonstrates that ROI-based volumetry revealed that young children with autism spectrum disorder have abnormally increased total brain volume. Children with ASD have increased amygdala volume, which is demonstrated here, although elegantly covered up. And juveniles and adults with ASD have reduced corpus callosum volume. VBM studies of ASD differ depending on whether density or volume analysis is performed. Most volume-based studies found increased gray matter volume in the frontal and temporal lobes. However, most density-based studies found decreased gray matter density in these regions. For white matter, both volume and density tend to decrease in the temporal lobe. The majority of SBM studies of ASD reported increased cortical thickness in the parietal lobe. longitudinal MRI studies of autistic individuals reported abnormal growth trajectories in the frontal and temporal lobes. CTI studies of ASD consistently report corpus callosum abnormalities across a wide age range, and differences in prefrontal white matter, cingulate gyrus, and internal capsule have also been consistently reported. Finally, looking at kind of functional MRIs demonstrated reduced strength and atypical development of the thalamotemporal connectivity in autistic individuals. And this was specifically correlated with severity of communication deficit, as demonstrated by MSc 2017. And taken in as a whole, there are numerous cortical and subcortical changes of the brain that have been demonstrated. And this can help us to understand some of the underlying structures that are involved and potentially target with which therapies or other things, medicine could potentially be used. Like to flip towards more EEG. Epilepsy is a well-known association with patients with autism, with reports of up to 30% of individuals. In one study, 36% of children with ASD were found to have infarctal epileptiform dystrophy. This suggests that there is a subtype of autism that is prone to cerebral excitatory imbalance. It is unclear, however, if excluding these underlying discharges in autistic patients contributes to clinically relevant outcomes. Several classes of medications, however, are used in autism that lower seizure thresholds, such as SSRIs, stimulants, and antipsychotics. So I think it's important to take into account those that have more of an excitable phenotype and should be used with care, these medicines, or else it could precipitate or unmask an epileptic potential. Event-related potentials have been looked at as well. High-density brain ERPs may play a role in early diagnosis and provide insights into underlying pathophysiology. Using negative central NC and P400 waves as parameters, individuals with autism spectrum disorder failed to show amplitude differences in ERP between familiar and unfamiliar. They showed differences between familiar and unfamiliar objects, however. Controls showed ERP differences between both familiar and unfamiliar faces as well as objects. And this suggests that autism spectrum disorder is associated with impairment in facial recognition in early developmental stages, the importance of which could be implicated with early screening. Finally, looking at eye tracking. Eye tracking has emerged as a potential tool as well in early diagnosis. The benefits of being a non-invasive and objective technique that underlies its potential. Studies have shown that children with autism have significantly lower gaze time in eyes and face, which is further exemplified when provided with a speaking face. Now, 15 years was more of the current challenges. And despite substantial research into the causes of autism, there remains a large portion of patients that do not find an underlying etiology. The advancement of different tools and techniques in order to investigate some of those more theorized aspects of autism pathogenesis, such as somatic mutations or epigenomics, may be helpful in uncovering further those that do not have an underlying etiology identified. Also, given significant population heterogeneity amongst patients with autism, study design becomes difficult, and large data sets are required to garner further association. So what's next? What are the future directions in this field? One will be expanding the databases of population genomics And this will aid in clarifying polymorphisms and structural variation risk, potentially allowing us to do more multi-genetic risk score analysis. Integration of multi-omic data to allow for a more precision approach is also on the horizon. Finally, and I think pretty cool, is that machine learning and artificial intelligence will provide avenues to process massive data sets and uncover insights otherwise impossible to understand before, which was demonstrated by Lin et al. In 2020, in which two gene changes were found to be associated with autism that had previously been discounted. But with artificial intelligence, that pattern could be realized. In summary, autism spectrum disorder is a complex neurodevelopmental condition with genetic and environmental influences. Specific genetics implicated in autism are associated with synaptic functioning, transcriptional regulation, and kinase phosphatase activity. Metabolic derangements have also been demonstrated in certain patients with autism spectrum disorder, associated with inflammation, fatty acid profiles, as well as mitochondrial dysfunction. And there may be subsets of autistic individuals within each of these categories that have specific treatments that could be more or less beneficial for them. Environmental factors such as gut microbiota, toxins, infections, and maternal autoimmunity have also been implicated in autism and could be thought of as mediating epigenetic changes. Finally, additional neurodiagnostic tools ranging from imaging to electrodiagnostic evaluation are also important to understanding the underlying pathophysiology, as well as in aiding early diagnosis in order to get those very important therapies started as early as possible. Here are my references. Great. Any questions?
Yes. Hi. That was an awesome talk. Really great.
Thank you.
I have a question regarding your proteomics and metabolomics data. Those are data from tissue. Are you aware of any studies of blood or urine that could have a predictive value or diagnostic value?
Yeah, so that's a great question. So that panel was actually the panel that was looking at the 9 proteins was actually blood, was a blood sample.
Okay. The metabolomics, but the proteomics was tissue. Oh, the proteomics was blood samples?
Mm-hmm. Yeah.
Okay.
Yeah.
And they only identify 9 different proteins?
Yeah, out of the 1,100.
Yes, that's amazing. I mean, I do proteomics on tissue and we have hundreds of hits on brain tissue, but
yeah,
I mean, it is amazing. And okay, thank you.
Yeah, no problem. Thank you.
Can you hear me okay, Jamie?
Yeah.
Great. This is an amazing presentation. It's just so thorough and comprehensive, and I thank you. I have quite a few questions because you opened up so much interesting information, but I don't want to hog all the time. So one useful clinician question is that excitatory phenotype in a, we'll say, nonverbal autistic child. What does that look like to you? Because we are always encountering children on a litany of psychiatric meds for behavioral issues, and oftentimes discontinuation results in improvement of their overall picture.
He's something.
So I was wondering if you could comment on what excitatory phenotype looks like.
Yeah, and I would like to kind of make one distinction. So the interictal discharge, specifically like during sleep or more of the sleep activated, CWAS or ESIS, doesn't include those individuals. Because you could certainly have language impairment or social impairment secondary to that. But as far as kind of the, hey, we see some discharges, it's not happening that frequently, but we see them and they've never had a clinical seizure. I think at that point it becomes more using your clinical judgment to, one, counsel families of what seizures look like, but that treating those discharges may not lead to an improvement in their social behavior, and that it may be just kind of co-occurring as part of their overall phenotype.
I don't have a question, just a comment. This was an amazing, fantastic presentation, Dr. Shoup. I think just extremely thorough, very well researched. Obviously, this is a passion project, and I'm excited to hear multiple variants of this talk, over the next couple of years. So just real congratulations, and very proud of the work you did here.
Thank you. Appreciate it. I had a lot of fun doing it. It's exciting to look at the literature. I'll make one comment that, a lot of these papers are coming out in the past 10 years, 10, 15 years. And so the amount of information that we've garnered in such a short period of time, and the, hope that we'll be able to garner far much more it's exciting. It's an exciting time.
We go and try to see if we can get the neuroradiology team. Oh, well, she's about to be here. She's not. Well, it's almost 9 a.m.
Oh, Aaron is there.
No, what I'm saying is that it's 9 a.m. Dr. Holiday is about to get here. I don't think we'll have time for it.
Oh, it's all time.
Yeah.
Thank you, Jamie. Great talk.
Thank you. You all have a good one. Thank you.
Thank
Great
you all
job,
so much
Jamie.
for coming. We'll
Thank you.
go ahead
Take
and
care.
call it now.